Hello, everybody, and thank you for joining me for another Wednesday Wellness episode with Leora. And today we're going to talk about how to strengthen the upper chest, the arms, the upper back, and the side, which is referred as the wings after bloc explant surgery. But first, to understand how to restore, we need to talk about the first phase, which is the breast augmentation. Dr. Randall Feingold, our expert, co-founder of New York Breast Reconstruction and Plastic Surgery, is going to explain to us what damage is done to the muscle and how during on-bloc explant he is restoring and actually mechanically touching these muscles so that they can gain more of their functionality. Once we're done with that, we're going to meet again Dr. Perry Nickelston. He's our wellness doctor and the lymphatic guru, and he's going to take us through unique exercises that can strengthen your neck, shoulders, upper back, and your glutes. So I can assure you as an exercise physiologist and a Pilates teachers that you can Google them or just find them in regular routines. They're very, very specific and the results are powerful. But first, I want to thank both Dr. Randall Feingold and Dr. Perry Nickelston who are here with us tonight. I'm going to address that first question to you, Dr. Randall Feingold. Let's talk about the specific of the damage done during breast augmentation.
Thank you, Leora. So I'm just going to point out that during breast augmentation, a breast implant can be placed either above or below the pectoralis major muscle. The pectoralis major muscle is the largest muscle in the front of your chest that controls movement of your arms, and it allows us to move our arm toward our chest, toward the midline. Very powerful muscle.
Yeah.
Many breast implants are placed under the pectoralis muscle for reasons that include prevention of capsular contracture or providing more soft tissue coverage or camouflage to hide the boundaries of the implant. This requires cutting through the pectoralis muscle and lifting it off of the rib cage, maybe cutting it off of the sternum as well. Now, the rib cage and the sternum are the origins of the pectoralis muscle that allow the muscle to pull your arm, your humerus, toward your chest. So when you cut that muscle, you're weakening the muscle.
Yes.
Furthermore, when you place the implant under the muscle, that lifts the muscle off of the rib cage to create a pocket to put the breast implant in. So instead of the muscle sitting flat against your chest, it's now been elevated off of the rib cage, and the angle by which it addresses your arm has been altered. So we have a change in strength of the muscle, and we have a change in geometry of the muscle when we place implants under a pectoralis muscle.
Yes. So when we talk about breast implant under the muscle or above the muscles, either of them is more damaging than the other?
Well, I think when the implant is above the muscle, we're not going to see the same weakening of the muscle, but it will have some concerns in terms of breast tissue potentially having bacteria in. If the implant is placed underneath the muscle, that has significant implications in terms of the excursion of our chest wall. When we take a deep breath,
yes,
our ribs that are all lined up together, they
yes,
expand and separate from each other. And the soft intercostal muscles between the ribs allow for expansion of our chest. When a capsule forms on the rib cage, those capsules can be very tight and unyielding. And when you try to take a deep breath, it will not allow the rib cage to expand. And so there are patients that have reduced ability to take deep breaths, and it can impact exercise, running, climbing stairs, or even everyday activities.
Would you say that, let's say, frozen shoulder and decreased range of motion and even weakness in the arms and the upper back, is this part of breast augmentation?
I definitely see patients with these types of complications related to their breast implants. Some patients have reduced range of motion of their shoulder, which you may call a frozen shoulder. We have other patients that have spasm, chronic pain in the pectoralis muscle. It's a very common complaint, and I think it's related just as much to spasm of the muscle as it is to contracture of the capsule. There's also reduced strength in that muscle in certain cases, depending upon how the muscle is cut. And then we see people with difficulty with deep breaths, complaining about inability to exercise or do sporting activities.
So how do you really fix this damaged muscle during an unblock explant surgery?
Well, when you remove the entire implant capsule, you're essentially recreating the cavity that the original plastic surgeon created when the implant was placed.
Yeah.
Capsule is taken off the undersurface of the pectoralis major muscle, and the capsule is simultaneously taken off of the rib cage. That's when I can appreciate in the operating room how it's created a tight band, almost like a plate of metal sitting on top of the ribs that the ribs couldn't possibly fully expand, with the capsule in place. So you take that capsule out, and all of a sudden you see better expansion of the rib cage. And you can see how the ribs separate from each other, even when the patient's not taking a deep breath. The next step is repairing the pectoralis major muscle. We don't want that pectoralis muscle to window shade upward toward the clavicle after removing that capsule and letting it spring free from its capsule adhesion. We want to take that pectoralis muscle, place it back down on the rib cage, bring it downward to a comfortable length to recreate its original anatomy, the way we were designed, and we want to suture it back to the chest wall. And that may involve placing sutures to the surface of ribs or to intercostal muscles or to the pectoralis minor muscle or the serratus anterior muscle to restore original anatomy.
So how long does it take to actually recover from such a surgery so a woman can start exercising without really risking and tearing those fibers muscles?
First, I'm just going to say that regardless of whether a capsule and implant are removed from above the muscle or from below the muscle, we don't want patients to have any bleeding as a result of surgery. And so I generally recommend that patients stay away from treadmills, running, heavy lifting, bending, stretching for 2 weeks. And that's because you're going to raise your pulse and blood pressure and possibly induce something to bleed, even if it was healing well for many days prior to that. After 2 weeks, I think that the risk of bleeding from most major surgeries is very, very low. And people can start walking more strenuously on treadmills or Stairmasters, or going back to spin classes or using light free weights. But in the case of people that have pectoralis muscle reattachment after a submuscular capsulectomy, they're going to have more pain. They're going to be a little more reluctant to going back to those activities, even at 2 weeks, even though I'm less concerned about bleeding at that point.
So I know from my experience, and I think I'm about 2 years post my on-block explant surgery, it really took me gradually, time to not just stretch the scar tissues, because I was feeling in the beginning a lot of pulling into the muscles, but also to regain the strength using weights.
When you asked me about the safety of resuming these activities, my first comment was about minimizing the risk of bleeding after surgery in the first 2 weeks. But even after 2 weeks, from week 2 to 3 and week 3 to 4, I'm much more comfortable with people increasing their activities, as I mentioned, but that doesn't necessarily mean activities focusing on the pectoralis muscle. If somebody wants to regain strength in that muscle, we certainly don't want to tear that attachment to the chest wall. And I would wait at least 4 weeks before attempting exercises like the pec deck, the bench press, or the push-up, because that's going to focus all that energy right on the front of your chest wall. You'd feel more pain, but we don't want to detach that pectoralis muscle that was secured back to the chest wall. So I would say 2 weeks of minimal activity to prevent bleeding, 2 weeks of resumption of activities without concern for bleeding, with the exception of chest wall exercises. And then after 4 weeks, then you can resume chest wall activities without fear of tearing that muscle again.
So that's a good general guidelines, for women. And I'm sure that for some women, they need more time to rehabilitate that area, and some other can go earlier. Is that true to say that not everybody, recover at the same speed and rate?
Well, that's certainly true, but I will tell you that in the first couple of weeks after submuscular capsular removal and muscle repair, most patients are able to tell me that
Yeah.
they feel a greater ability to take deep breaths,
Mhm.
even at rest, and they didn't appreciate before surgery how restrictive their breathing was until their range of motion of their entire chest wall was restored by the capsulectomy. And most women can tell that their pectoralis muscle doesn't have the tightness or the spasm, even though I had operated on its undersurface, even though I had reattached it. There may be a time period to return to these functions, and everybody will certainly recover at a different rate. But I think that most patients can tell that there's benefit to returning them to normal anatomy.
We are, in fact, going to talk in a moment with Dr. Perry Nickelston, and he's going to tell us how to recover, those muscles, strengthen them, increase the range of motion, and specifically target exactly the area that women are so complaining about after on-bloc explant. But first, I want to thank you, Dr. Randall Feingold, for really shedding light on that important topic and just bringing awareness. And I think that there is a way to rehabilitate it, I would say educated way, and just regain the strength, but also the static shape of the entire chest.
Thank you, Leora. This is a really fantastic topic, and I can't wait to hear what Perry says.
Okay, so let's turn to Dr. Perry Nickelston, and I want to thank you, Dr. Perry Nickelston, for being here tonight again. And let's talk first about how do you start restoring? What's the first step in the restoration of the chest?
It's a traumatic experience to go through this emotionally and physically, but the surgery itself, right? So you're going to have tightness and tension and restriction in the front of your body, of course, right? Around the pec minor, which you discussed, and that muscle's tight on people in general all the time. And then you have the pec major. So these communicate with each other on both sides. The very first place I start with anybody who's had any work around the pectoral region, from breast augmentation, explants, even with heart surgery procedure, or working with the neck, strengthening up the neck, because nobody ever looks at the neck. And you need to look at the neck because that's one of the most important places in your body, because it holds your brain up. And the nerves in your neck, they travel down in your arm, right? So that's really important. So if you want to try to strengthen your bicep and your triceps and your forearms and even your grip, that's beholden to the nerves in the neck. And a lot of people will have poor neck posture. And why is that important? Because it's going to compromise the nerves in the neck, which can compromise the nerves down the arm, and also the blood flow to the brain. Now, why is that important? Because there's actually a really fascinating part of your brain stem. There's brain stem that sits in the back.
Yeah.
And I'm not going to get too far in the weeds here, but I really want you to understand why I'm saying this.
Yeah.
That means that there's two parts of the brain stem that control your ability for your muscles to relax. And if that doesn't work, it gets you locked into tight muscles, sympathetic dominance in the chest and the arms, which means that if you have poor neck alignment and you have poor blood flow to that part of your brain stem, then those areas are always going to be tense and tight no matter what you do. So what that does is that when you work the neck, you can help blood flow to the brain and nerve flow, and that automatically can help relax the muscles of the chest that are really tight and the shoulders, because you can't stretch that stuff out. If it's locked into the brain like that, the brain has to let it go. So the very first thing that I do is I teach neck exercises for people to do.
Oh.
You can do isometric neck exercises where you're just sitting and You actually would put your head in all different directions, what they call flexion, which is bending it forward, extension, which is bending it backwards, lateral bending, which is trying to bring your ear to your shoulder on both sides, and then rotation where you're twisting it. Okay. Yeah. So those are just moving it. But isometrics means this. You would actually place your hand on different parts of your head, and you would be trying to push your hand into your head and your head into your hand. So it's an isometric. So nothing's moving, but you're really engaging that muscle. Isometrics can make you really strong, and they can help stabilize your neck, because you can work up to things, but you really want to be careful on jumping into using weights for your neck if you're not even used to really moving your own neck. That's like trying to do a squat when you've never squatted. I'm going to throw 100 pounds on your back. That is the first place I check, because it affects all of the other exercises that you want to do afterwards. Yeah. Having a strong neck so you can support your brain and have good blood flow to the brain, and also you can get good oxygen flow to the brain because you have better neck alignment for your airway. That's really important. Okay. Yeah. And if you've been through those kind of procedures, I know people typically have a lot of weakness in the neck, and because what you have to remember is that all the tissue in the body is connected with fascia, right? Yeah. So when you do anything to the chest, that fascia goes all the way up and attaches to your jawline. It's called your platysma muscle. And that is a major muscle here that you need to strengthen. So a lot of people will have continual issues down in the chest region because of stuff higher up. So with the isometrics, what you would do is, one, I always recommend people do it seated first, because it's easier to control, because you don't have to worry about the rest of your body doing anything.
Yeah, stabilize your lower part.
Yeah. Make sure that you keep your mouth closed, teeth slightly apart from each other. And I want you to try to breathe in and out through your nose the whole time. And for even better alignment, this is going to help you even with your shoulder posture and how you're standing all together, is to place your tongue, the tip of your tongue, the middle of your tongue, and the back of your tongue up against the roof of your mouth the whole time. So the tongue stays to the roof, the mouth is closed, to breathe in and out through your nose. Then what you'll do is you'll place a hand on your forehead, the palm of your hand on your forehead, and continue to breathe. Don't stop breathing. I want you to push your hand into your head and your head into your hand, and I want you to do that for 10 seconds. But don't go too hard as to where it hurts. You should have no pain. Okay. Don't stop breathing, because most people will stop breathing. And then when you stop, don't just completely stop. Lighten up your pressure on your hand and on your head at the same time. So you ease, you back off easy, and then you relax. Yeah. Now what you can do is you do the back of the head. This one is usually good if you interlace your fingers and you put your hands behind your head. If you can, if you have the motion in your shoulders here, like this, and then you push your head into your hands and your hand into your head into extension. And you do that for 10 seconds. Yeah. Now, the lateral bending, you need to go easier on, because people usually don't bend their heads sideways. So what you do is you place one of your hands on the side of your head along your temple and what's called your parietal bones on the side of your head. Make sure your nose is straight. And I want you to push your hand into your head and your hand into your, and hold that for 10 seconds and slowly back off. And then you do the same thing on the other side. Okay. And then the last one you're going to do is rotation, right? So with rotation, what you're going to do is place your hand right at the temple, above the cheekbone. So go above the cheekbone and put your hand right at the temple. And what I want you to try to do is look over that same side shoulder that your hand is and resist that motion. So you start with that one round, then you can add another round. Okay. If you feel okay with that, then what you do is you now get into actual trying to moving your head against gravity. This one is where you lie flat on your back on your bed. Yeah. You hang your head off the bed
Okay.
Then you
And
bring your head, you do flexion up, bringing your chin to your chest, because now you have to fight gravity. Because I'll tell you what, if you own your neck, you're going to be a monster with all of the other ones.
so what you're saying here is that the neck is often very neglected. And once you learn how to stabilize it and strengthen it with the isometric exercises, you will gain more strength in the lower parts of the body.
Yes, you'll get better everywhere, because
Yeah.
the neck is one of the most important places in the entire body, because the brain sits on top of it. And here's what I want people to know is that just moving your head around during the day is not enough to give you a strong neck. You have to do exercises, you have to do sets, you have to do things on purpose
Yeah.
to build up nice legs, nice pecs, nice biceps. You should do the same thing for your neck.
Yes.
All right. Because if your neck alignment is off, then everything is off for your shoulder blades and your scapula. So that's great that people do those, but if you want to take it to the next level, then you train the neglected part of the neck. Okay. Yeah. So what you do is you do the isometrics just so you can start to get your body comfortable with some strengthening in there.
Okay.
Then you go on the bed, like I said before, and you lie on your back and you let your head hang off and you bring your chin to your chest 10 times. Then you turn over to your stomach and then you bring your head backwards into extension 10 times. Then you turn on your left side and you bend your head sideways 10 times. You turn on your right side, you bend your head sideways 10 times, because you have to fight this thing called gravity. And you're going to be blown away at how weak your neck is.
Yeah.
Right?
So when you're doing this, let's look into timeline.
Like I said before, it's going to be a little bit of a different timeline for each individual. I don't think you can cookie cutter and say, okay, 6 weeks from now, you can do this. It's variable. But I'm a big believer in basics and fundamentals and old school things because they work. So one with the neck, then think about the universal exercise that you could possibly do to strengthen up your pec, but you also get your lats in there, your back, and you also get your abdominals and your core. And that's your good old fashioned push up. Because I tell people this, I'm not going to have you pushing weight if you can't do a push up.
Oh, wow. That's interesting. Because when you push up, you're pushing up, aren't you pushing up your entire body in a way? But you also have to isometrically hold your core, pull it to your spine.
A push up is a moving plank, is what it should be.
Yeah.
But you don't have to go down to the ground. That's the hardcore one. So what you do is you start off easier, where you just lean against something like a wall, a doorway,
Yes.
a piece of furniture, something like that, a couple of chairs that you go on. So your leverage point is different.
Yes.
And then you work your way up from there. And that one just takes repetition.
You recommend the push-up with the elbow squeezing into the waistline, into the rib cage, or wide push-ups?
First of all, the key to a push-up is squeezing your glutes first. So you want to squeeze your glutes because that pulls your pelvis into a posterior pelvic tilt. So that automatically locks in your core. So squeeze your butt first, but don't stop breathing. Right? And then what you want to do is I teach people called a corkscrew. So if I have my hands against something here, and if you think about your hands as like making circles, right? So what I tell people is that notice what happens is if you have your hands in front of you like you're doing a push-up, right? I want you to turn your hands outward like this. So you rotate them out and notice what happens to your elbows. They come in. And if you keep turning them in, what do you feel engaging? You should feel your back. I want you to feel the other way. Put your hands back out like you're doing a push-up. Now turn your hands in and tell me how good that feels. That feels awful.
Absolutely. You know why? Because I'm raising my shoulder up and I'm disconnecting my shoulder blades from my back.
Yeah. So you're also destabilizing your shoulder.
Oh, wow.
So the answer to your question is this. You want to keep your elbows in, but you want the motion to be corkscrewing out through the hands. So now imagine this. you squeeze your butt,
Yeah.
and then you turn your hands out,
Yes.
and now your lat kicks in. Guess what? You just engaged everything on that back chain that you need to keep you opened up into, extension.
Wow.
And you're going to have a much better push-up because you're engaging the whole body. You're not just hanging on your pec and your shoulder, because a push-up is not a pec move.
It's really interesting when you talked about the glutes, and that's something that you have to remind them all the time, that your glutes have to fully pull in, engage, fire up. Then you think about your core, then you think about pushing and stabilizing your shoulder blades. Then you start thinking, like you said it very nicely, you're moving from a plank position to push up, and then you just see how far you can go. And then we can modify it by just changing the angle of the body. You could be standing up against the wall or even against your kitchen counter. I'm looking at it from this angle.
When you squeeze your glutes first and you do a push-up and then you do it without squeezing it, you'll go, oh my goodness, I can't believe the difference. It's a light bulb moment for you. And most people have weak glutes and what they call weak lats. That's a weak back. And if you strengthen those up, that's automatically going to pull your posture back to improve everything. Because you have to remember, we talked about everything being connected. Your shoulders connect to the opposite side hip on the front and the back. That's called fascial slings. So I tell everybody, if you have a weak butt, there's no way you're going to own your chest. That's not happening. So when you want to get better up top, you do some glute work, you do hip thrusts.
I want to go back, repeat something I heard from you that was very interesting. You said that the shoulders are connected to the hip through the fascia.
Yeah, it's from Thomas Myers, who wrote a book called The Anatomy Trains, which I would highly encourage everyone get. He's very brilliant. And he shows how the body interconnects with the fascia, which is connective tissue, an X pattern, where your right shoulder goes diagonally across to your left hip on the front and the back. Your left shoulder does the same thing with your right hip. That X pattern crosses the body in the front and it crosses the body in the back. So when you do the tighten up the glute, pulling in your lats in, you lock in the X.
Oh, wow. Right? We're going back to what you said earlier, stabilizing the body before you're moving, which makes it so powerful.
Yeah. So when you move, you need a combination of a couple different things. So you need what they call mobility, which is the ability to actually move. But you also need, which is a part that many people miss, which is called stability. And stability is the ability to resist movement. But what you realize is that you can't move if you don't have stability. So otherwise, you'd be a big blob on the floor. You wouldn't be moving anywhere because you don't have a stable anchor point to move from. So stability is the actual key to it. That's why the isometrics work. Because if you have if you have a stable neck from doing the isometrics, you automatically have more strength and range of motion in your arms and your legs right from the get-go.
This is interesting. Very often the neck is an issue, especially when we're working on the upper trunk and the arms, and then the head is somewhere not in alignment.
If you bring it forward, called forward head carriage, that automatically compromises your entire oxygen flow from the get-go. And you compromise blood flow to the brain. And trust me, that's not going to work out well for you in the long run. If you have your head sitting out over the shoulders, you can do all the diaphragm breathing work you want, and it's not going to make a bit of difference. You got to own your head. You got to own your neck. And most people don't know where it is because they have no sense of body awareness on their neck, and their mouth is usually wide open, and they're breathing in and out through their mouth when they exercise. And you should never breathe through your mouth when you do anything. It's always through the nose, even when you exercise.
That's a perfect cue to give when people are doing yoga and Pilates. When you're doing the plank position, do you suggest a neutral spine?
You pull your chin back. I want to put a stick on your back and have it touch the back of your head, your shoulder blade, and your butt. One straight line. Yeah. Because most people, when they do a plank like this, their face goes towards the floor. You
Yeah.
lost it right from the get-go. You need to pull it back. And that's why tongue placement matters, because when you put your tongue, the front, middle, and back to the roof of your mouth, your head automatically pulls back
Well, this is,
right from there. So yeah, that's a big one, because your tongue will be resting at the floor of your mouth where it doesn't belong there. It should be off the floor of the mouth.
it's an effort to keep it up.
Yeah, it's going to feel like it doesn't belong there, but it's supposed to be there. It just hasn't been there in so long. You're not used to it. You got to put your reps in like anything else. And it's the same thing with the tongue. Yeah, it just takes time.
Okay, so let's talk about one final movement. Implement.
It's what's called a farmer walk or a loaded carry. You hold something in your hands that's heavy and you walk.
Oh,
That will absolutely transform your body faster than anything next to the neck. Like, have your arms rest by your side and imagine that you're holding 2 dumbbells, one in each hand, right by your side, like you're carrying a suitcase in the airport. It's also called a suitcase carry. Loaded carries will make you an absolute monster. And because they will correct your posture quick, fast, and in a hurry, because you have to stand up tall, lean, mean, and confident to hold the thing. It's a standing walking plank is what it is. And then now at the same time, you would put your tongue at the roof of the mouth, pull your head back, lock yourself in, and walk. So you start off with a weight in both sides. And then the side plank version is this. You only hold something on one side. So imagine that. Imagine if you're standing up, and let's say for a number, you were holding 50 pounds in your left hand and nothing in your right. What's going to happen? The weight's going to pull you to your left-hand side. That's what a side plank is. But now it's functional. You got to walk. You got to move, right? You can use pretty much anything that you want to hold in your hand. Dumbbells work well. Kettlebells work well. You work up in this one in weight and in distance. But in the beginning, I usually have people start with the same weight in both hands because it's easier to control. And then you go 100 feet one way, 100 steps.
yes.
And then if you can, turn around, do 100 feet back. If you can't, then you go 100 feet, you put the weights down, then you pick them back up and you go back 100 feet. You would, do the same thing, but you would switch and only carry it in one side. One of the things I like about a farmer walk is that it's grip. So whenever you grip something hard and you carry it, you automatically engage the shoulder joint and your rotator cuffs more than anything.
Okay.
Like, it is a fantastic shoulder strengthening exercise as well.
Naturally, we have that area weaker. So any other suggestion other than these 3 exercises that you already gave us?
Yeah. So those 3 you're doing before are fantastic in and of themselves, because a more stable neck gives you a stronger shoulder.
Yeah.
A push-up automatically gets your shoulders stronger.
Yes.
But you'll have better shoulders when you have a stronger butt back from push-ups.
Oh, wow.
And loaded carries will automatically stabilize your rotator cuff that holds your shoulder in place. So then what you do is you do a classic. I'll show you. It's called an Arnold Press from Arnold Schwarzenegger. So here's what you do. If you can see me in here, I'll try to walk you through it. You would take some dumbbells.
Yeah.
So let's say you're going to do dumbbell presses. Perfect. So hold the dumbbells in your hand and put them out like you're going to do a press over your head.
Okay.
What I want you to do is now bring your elbows towards the center and try to touch your elbows. Then bring them back out.
Yeah.
And now press over your head. Come back down and bring your elbows in again. And if you want to turn your elbows in a little bit, you can, like this.
With this?
Like
or
you turn your hands in like that.
Yeah.
And then come back out and press up. Come back down one more time. Bring your elbows in and now turn your palms towards you. And now bring them back out again like that. That's called an Arnold press.
Okay.
It's fantastic. And now remember, a lot of people, when they press up overhead, what do they do with the neck?
Come forward.
It comes forward that way.
I
So
know.
now you're already a monster because you've got your neck that
I
you
like
trained
that.
before. So that's going to be a lot easier. So what I'm trying to teach people is it's not just the exercises that you're doing. You have to know when you do them and how they help the other exercises that you're doing afterwards. So you're not just throwing anything at the body. There's a strategy to it.
Absolutely. This is totally enlightening. I've learned so much in that short conversation that we have had. And I definitely agree that it's important to learn all these things and incorporate them. And that's what I like so much about your practice and your teaching, because you're incorporating everything and you're layering it down.
Exactly. Listen, this should be a long-term rest of your life thing that it makes you feel good, but you also enjoy doing it. Otherwise, you probably won't do it for long, right? Your health is not a destination, it's a direction.
Oh, wow. It's a process also, right?
Yeah, which means direction means it's going to zigzag. It's not a straight line. It's going to go all over the place, but that's what the body needs. It needs things that are different because that's how it becomes more resilient when it has a challenge like that to do. But many people can get bored very quickly with doing the traditional exercises, but you should do them because they really work. But I wanted to teach you some things today that what I call high value targets. If you do these, they help you in so many other different ways that you'll feel it when you do those other things. That makes sense.
Exactly.
Just don't forget to breathe. Okay? And then when you're done with that, what you're going to notice is you're going to feel so much more alert and alive in your head. And here's a reason. Neurologically, your hand takes up a huge amount of space on your brain because that's the primary way that you interact with your world.
As always, I want to thank you so much for taking your time and coming here. Dr. Perry Nickelston, you're always enlightening. And I want to thank you for being here with us tonight.
Thank you so very much. I had a wonderful time.
Thank you. I'll be in touch and we'll see you soon.